Today, we're diving into some groundbreaking news when it comes to type 2 diabetes and obesity. And I gotta tell you, it could affect millions of people. We've been talking a lot about two game-changing drugs, Tirzepatide and semaglutide. These medications have been revolutionizing how we treat type 2 diabetes and obesity. But today, we need to discuss some crucial new information about semaglutide that just came to light. First, let's recap what we know about these drugs. So Tirzepatide, which is also known as Mounjaro and Zepbound, and then we have semaglutide, also known as Ozempic and Wegovy. These are part of a class of drugs called GLP-1 receptor agonists. They've been making waves because of their impressive results in lowering blood sugar and causing weight loss. The SURMOUNT trials for Tirzepatide, published in the New England Journal of Medicine between 2022 and 2024, showed jaw-dropping results. We're talking about weight loss of up to 22.5% in adults without diabetes and up to 15.7% in those with type 2 diabetes. Some participants even saw 25 to 26% weight loss in the SURMOUNT 3 and 4 trials. That is unprecedented in the world of obesity treatment. We're basically talking about percentages that are similar to bariatric surgery. Semaglutide, while not quite as powerful, still showed impressive results in the STEP trials. We saw weight loss of up to 15% in adults without diabetes and 10% in those with diabetes. Both drugs have also shown benefits beyond weight loss. They've demonstrated improvements in cardiovascular health and kidney function. The FLOW trial, published in July, showed that semaglutide reduced the risk of major kidney events by 24% in those with type 2 diabetes and chronic kidney disease. But here is where things get complicated. A new study just published July 3rd in JAMA Ophthalmology has raised some serious concerns about semaglutide. This study, led by Dr. Himina Tatiana Hathaway and her colleagues, found an association between semaglutide use and an increased risk of a condition called non-arteritic anterior ischemic optic neuropathy, or NAION for short. So NAION is the second most common cause of blindness due to optic nerve damage. The study looked at over 16,000 patients and found that those prescribed semaglutide had a significantly higher risk of developing NAION compared to those on other medications for diabetes or obesity. For patients with type 2 diabetes, the risk was 4.3 times higher. For patients who were overweight or obese, that risk was 7.6 times higher. Now, it's important to note that this was an observational study, not a randomized controlled trial. So while it shows an association, it does not prove causation. But it's still a major red flag that we cannot ignore. This new information shifts the balance even further in favor of Tirzepatide over semaglutide. Here's why. Number one is the efficacy. It just works better. Tirzepatide has consistently shown superior weight loss and blood sugar control compared to semaglutide in head-to-head trials. Specifically, the SURPASS-2 trial, published in the New England Journal of Medicine in August of 2021, directly compared Tirzepatide to semaglutide and demonstrated superior results for Tirzepatide in both weight loss and blood sugar control. Then there's number two, the cardiovascular benefits. While both drugs show promise in this regard, Tirzepatide seems to have a slight edge in improving cardiovascular risk factors. Number three is the safety profile. With this new data about potential vision risks with semaglutide, Tirzepatide appears to have a more favorable safety profile. As of now, there have been no similar reports of increased NAION risk with Tirzepatide. Then there's number four, the dual action aspect of this. So Tirzepatide works on both GLP-1 and GIP receptors, which may contribute to its enhanced efficacy and potentially different side effect profile. But overall, these medications have more or less the same side effect profile, mostly GI related, such as nausea, vomiting, diarrhea, constipation, upset stomach. However, it is crucial to remember that Tirzepatide is still a newer drug and long-term data is still being collected. So we need to stay vigilant and continue monitoring for any emerging safety signals. So what does this mean for you if you're currently taking semaglutide or considering starting it? First, don't panic. The absolute risk of NAION is still relatively low, but this is definitely something you should discuss with your doctor. If you're experiencing any vision changes while on semaglutide, definitely seek medical attention immediately. For those who haven't started treatment yet or who are considering switching medications, overall, tirzepatide is definitely the better option given it works better and so far has a more favorable safety profile. But remember, the choice of medication should always be made in consultation with your healthcare provider, taking into account your individual health status and risk factors. This new study also highlights the importance of ongoing research and post-market surveillance of new medications. As these drugs become more widely used, we may uncover both additional benefits and risks that weren't apparent in the initial clinical trials. So far, there's a lot of exciting research demonstrating the power of these medications when it comes to preventing diabetes in high-risk individuals. For example, the Surpass Prevent trial, currently ongoing, is investigating whether tirzepatide can prevent or delay the onset of type 2 diabetes in those who are overweight or obese. Results from this study are expected to open up a whole new avenue for diabetes prevention. We already know that tirzepatide lowers insulin levels, lowers hemoglobin A1C levels, lowers cholesterol levels, it even lowers blood pressure, it even lowers CRP levels. So basically, we already know that tirzepatide lowers all the markers of insulin resistance and metabolic dysfunction. While tirzepatide and semaglutide represent major advances in the treatment of diabetes and obesity, this new data suggests that tirzepatide might be safer and more effective option for most people. However, we need more research to fully understand the long-term effects of both of these medications. If you're currently taking semaglutide and you're concerned about this new information, don't stop your medication without consulting your doctor first. And if you're considering starting treatment for diabetes or obesity, make sure to have a thorough discussion with your healthcare provider about the potential risks and benefits of all available options. And if you want a consultation with a board-certified obesity specialist, I'll drop a link below this video. This is Dr. Mike Hansen signing off, and I'll see you in the next one.